Did you see the latest report by the United Nations on global fertility rate? Hello, my name is Chinasa Imo. Welcome back to the What About Rural Health, the space where we center stories and voices too often left out in global health conversation. Today, I'll be diving into something that's been making headlines around the world. And I am not talking about the crisis in the Middle East. This will be the declining fertility rate. I want to go beyond the panic and look at what exactly is really happening, especially for women in rural communities. And I'll be responding to the section of the report that struck a chord with me. And this report is the 2025 UNFPA State of World Population Report. They titled it The Real Fertility Crisis, the Pursuit of Reproductive Agency in a Changing World. This report asks a bold question. Is the crisis really about the declining birth rate, or is it about the lack of reproductive agency? And this will be the inability of millions of people around the world, especially women, to make meaningful choices about their reproductive life. There is a quiet panic echoing around the policy space. What happens when women stop having children? And in response, we have seen leaders rolling out incentives to nudge or pressure women into motherhood. But the real question we should be asking is this: what happens when women do not have a choice at all? That, right there, that is the real crisis. And for women in rural areas, that crisis is far more profound. Subscribe to our YouTube channel to watch the full video and join the conversation. So let's start by talking data. As a researcher, I'll definitely begin by talking numbers. So back in 1960, women globally were having an average of 5 children. But today, this number has dropped to about 2.2 and is even projected to fall below the replacement level of 2.1 by 2050. What this means in simple terms is that if every woman has fewer than 2 children, over time, population would start to shrink unless there is something that is done to offset it, either through migration or other factors. On the surface, this looks like progress because in many countries, this drop would reflect positive shifts such as, more education, greater reproductive freedom, better economic opportunities. But when we dig deeper, we find that many women, especially those living in the global south, that this decline is not really a choice, it is a consequence. Now, the UNFPA report shows that people everywhere are having fewer children than they want. Across the 14 countries that they run their data, nearly 1 in 4 of the people who responded wanted a child but couldn't have one. Not because they changed their minds, but because life changes the rule. They couldn't afford to eat, they lacked support, they were stretched thin by the burden of survival. Meanwhile, in some other places, nearly 1 in 3 had experienced an unwanted pregnancy. And this highlights both overachieved on one hand and underachieved fertility. But here is the kicker. 257 million women wanted to avoid pregnancy, but they were unable to access modern contraceptives. What this means: these are not personal failures, they are outcome of system failures. So here is where the fertility crisis, narrative falls short. It assumes that people are choosing freely. Let's take Namrata, a working mom in Mumbai that was featured in the BBC story. She and her husband wanted to have a second child, but the costs of living, such as school fees, healthcare, basic survival, made that dream to become impossible. Her story is echoed in the UNFPA survey, because when asked, they weren't having more children because of lack of money, lack of time, and lack of support. So when policymakers say people are choosing to have fewer children, we have to pause and ask, is that really a choice? Because what the data actually show is this: people are having fewer children than they want because of financial and structural barriers. People are having more children than they want because they lack access to contraception and autonomy. And in both cases, it's a loss of agency. Yes, let's talk a little bit about the global push for family planning. Over the last few decades, reducing fertility rate has been a major public health goal, especially in the global south. And yes, we've seen real wins, such as the increase in access to contraception, expanded maternal health services, and a broader sense of control over one's reproductive health. But the reports have also forced us to acknowledge a painful legacy that some of these family planning efforts leaves, such as cohesive family planning programs, top-down targets, and medical abuse, especially towards the poor, indigenous population, and rural women. This creates a huge distrust of the health system, especially in rural and low-income settings, where healthcare often feel extractive than supportive. Subscribe to our YouTube channel and monthly newsletter to stay up to date with our latest information on rural health. Welcome back. So let's discuss what this means for rural health and women in rural and low-resource communities. You can't plan your family if, one, the nearest clinic is like 5 miles away. Secondly, there is no trained healthcare provider to deliver right-based care, or no stock of contraceptives and other life-saving medical consumables such as oxytocin, misoprostol, magnesium sulfate, sterile kits, IV fluid, and the list goes on. There is no privacy or safe space to ask questions. You can't make empowered decisions if you are navigating gender-based violence, poor nutrition, forced marriage, and systemic poverty every single day. There is really no choice to begin with. And in places like Nigeria, South Africa, and India, these 3 countries were highlighted in the report. Women point to the same barriers to achieving their desired family size: financial stress, lack of childcare, unemployment, and male partner opposition. And while sub-Saharan Africa hasn't reached sub-replacement fertility level yet, we are seeing an early shift due to urbanization, access to family planning, education, and gender equality effort. This is leading to a slow organic fertility decline. Now, the point is, behind every data point is a human story, and behind every decline in birth rate, there is often a system to explain that. So therefore, we need to look behind the number and start asking, why are women having fewer or no children? To answer this question, for many women, choosing not to have children is a form of resistance. The UNFPA reports may have revealed so many important insights, but one of the most important, powerful points is this: many women are choosing not to have children or to stop at 1 or 2. Like I said before, not because they don't want them, but because the system makes it too risky. For these women, it's not just a choice, it's a survival strategy. In the Philippines, one of the women responders shared, a lot of policies worldwide are against women's health care. I feel that this pushes us to stay single and have no children. That's not an apathy. That's a policy feedback loop. When system fails to support women when they face violence, poverty, or poor care, many decide to opt out of motherhood for self-protection and as a risk management strategy. And we have seen that instead of countries to address this, there's a whole lot of policy mistake that is showing up in countries like Hungary, South Korea, and China, and many other countries that are starting, with this policy. These countries are now offering cash incentives and launching pronatalist campaign to boost birth rates. Instead of building inclusive systems that listen and reflect what women really need, these governments are choosing to pressure women into motherhood. Policies driven by panic would always miss the mark, because true reproductive justice is to build a system of care where women can make informed and supportive choices, whether that is having children, not having children, or choosing to do so later in life. So you may ask, what do women really want, especially those living in rural communities? The answer is actually not complicated. What they want is 1. Affordable and safe health care. 2. Respectful and dignified care that privileges their agency and autonomy. 3. Freedom from violence. 4. Education for their children. 5. Equal partnership at home. And the last is a hope for a secure future. In fact, in most of the world, people said that they ideally would like to have 2 children, but they have to revise their goal downward because of poverty, lack of partner support, war, climate change issues, and fear of instability. Therefore, policy must follow people. Instead of focusing on policies that try to engineer fertility rates to fit a particular narrative, whether to increase or decrease birth rate, we need to shift the focus. The real goal should be supporting women to thrive, because when women, especially those in rural communities, feel safe, heard, and supported, they make decisions that reflect what is best for their families and for the future of the society as a whole. So, as we reflect on this report, let's be clear on one thing. The problem is not that people are having too few babies. The real issue is that too many women lack the agency to make the most intimate, life-defining decisions for themselves. What they need are policies and programs that trust women, invest in healthcare system and infrastructure that uphold reproductive agency, and create the enabling environment that shape the future that women believe in. This is where What About Rural Health comes in. We are here to say no more invisibility. Rural women must be at the center of every reproductive health conversation, not as passive recipients of aid or targets of population control. They should be the leaders. They deserve care, dignity, and for their voices to be heard. This means more investment in rural health infrastructure, more protection against gender-based violence, and more clinics and more spaces like these that we have created for women to speak their truth. Because the real fertility crisis isn't about the numbers, it's about equity. And because progress means that women can say, yes, I want to have a child or children. No, not right now, or this is enough for me. Thank you for listening. Until next time, let's keep watching and keep asking, what about rural health? Let's create this narrative together. Thank you very much. Please follow us in all our social media platforms. We have our podcast coming up soon, and we have a resource repository on our website. That's something that I haven't spoken a lot about. So please check out our website at www.whataboutruralhealth.com. Until next time, thank you.